Hello, and thank you to the Baylor Alumni Engagement for sponsoring the webinar today. I am Dr. Linda Plank, Dean of the Baylor University Louise Herrington School of Nursing. With me today is Dr. Karla Ramberger, Chief Nursing Officer at Baylor University Medical Center. Now, we always call Baylor University Medical Center BUMC. So for those of you that are not familiar with that, that is just the terminology you will hear and become very familiar with. It is the North Texas flagship hospital of Baylor Scott and White Health System. I want to start out by allowing Dr. Ramberger to describe BUMC and the Baylor Scott and White Health System.
Thank you, Dr. Plank. Baylor University Medical Center was established in 1903, so before Dr. Plank and I were nurses, but in 1903 by Reverend George Truitt as the Texas Baptist Sanitarium. It was a 14-room renovated house in 1903 when it was started. We are today a quaternary medical center with over 914 licensed beds. And when I say over, during the pandemic, we have opened additional beds. We have over 128 intensive care beds, which makes us one of the largest hospitals in the Metroplex and in the state. At BUMC, we have over 4,900 employees, and I'm excited to say that over 1,200 of them are registered nurses, where the majority, 89%, hold a BSN and 42% have their specialty certification. BUMC is committed to our community, which is evidenced by us having over 39,000 admissions in FY20, approximately 4,000, which are our newborns, or what we like to call Baylor babies. We serve the community through several different avenues in the medical services, from transplants. We started our transplant program, the first in the city, in 1986, and we've almost had 10,000 transplants since that time. We have advanced oncology services, neurosciences, orthopedics, digestive services, and cardiovascular programs at BUMC, just to name a few. In 2014, Baylor Scott and White came into fruition from the combination of Baylor Health and Scott and White, and now we are known as Baylor Scott and White. With the combination, we now together have 7.5 million patient encounters and more than 208 hospital admissions. With all of Baylor Scott and White Health combined, which goes all the way down to Austin and up to Denton, we have 52 hospitals and over 800 care sites. We are part of 49,000 employees and 7,000 physicians that serve across our communities across the system. Linda, thank you for letting me talk about Baylor University Medical Center. Why don't you give us a little more information about Baylor University Louise Herrington School of Nursing?
Okay. Well, like you mentioned, the hospital started in 1903, and I guess it took them about 6 years to realize they needed a nursing school. But that was a very common way to get nurses back in those days, is to actually start the nursing school and have people work and learn at the same time. So in 1909, we began as a diploma program for the Baylor Hospital. It took us about 50 years to realize that we wanted to have a baccalaureate degree, and that started around 1950. I think the first graduates were actually 1952. And since that time, we've been doing the traditional 2 years in Waco to get your prerequisites, and then another 2 years here in the Dallas area to get your baccalaureate degree. A lot of people will ask, when did you move to Dallas? Well, we've always been in Dallas. And because of the great clinical sites that we have here, we will probably always be in the Dallas area. So we presently have over 1,500 students. That's about 360 on the Waco campus in their freshman and sophomore year. About 400 in Dallas that are completing those 4 years, so their junior and senior year here in nursing school. We have 80 post-baccalaureate students in the program that we call the FastBac program, and that means they're getting their 2 years of nursing experience in 1 year. We started 70 post-baccalaureate students just started in August in a new program that we're trying to mimic what we did with the Fastback program, but have it totally distanced from the campus. So those students actually stay in their hometowns. They come here to our campus for only 2 weeks in the whole 52 weeks that they're in school. And then they do their clinicals in the areas closest to their home. One of our goals is to try to help some of the rural hospitals that are in Texas really struggling right now, because it's hard enough to run a hospital, but if you're running a hospital in a rural area where it's hard to attract nurses or hard to keep nurses, it really is a difficult financial move. So we would like for these nurses to be committed to their community, get their education, and stay in those hospitals that have helped them in their clinical sites. So that's a new program for us. We'll be able to give you more results later after we have our first graduation group in August. There's a total of 910 pre-licensure students in Baylor University's Louise Herrington School of Nursing presently. The graduate programs have really grown, though, in the last several years. 4 years ago, I had to say we have less than 50 graduate students in all of our tracks, but now there's over 660 just in the growth in the last 4 years. So the tracks that we have are ending up with a degree called a Doctorate of Nursing Practice. It is not the PhD research degree that nursing has had for many, many decades, but a Doctorate of Nursing Practice is a clinical doctorate. So we have tracks in nurse midwifery, neonatal nurse practitioners, family nurse practitioners, pediatric nurse practitioners, and executive nurse leadership. The growth has been mainly due because we're now an online program and the students can be anywhere in the United States, but they do come to our campus for immersions and skills throughout their program. This year was the very first year we were able to graduate a cohort from our anesthesia program, but we partnered with the U.S. Army 3 years ago in their CRNA program that is housed in San Antonio. Those students spend 1 year getting their didactic classes, and then they're deployed to all over the United States, wherever an Army base needs them, and any place that there's Army families, they may go to give anesthesia for the families of our soldiers. So we graduated 36 students just on Saturday from that program, and we're very, very proud because that program is ranked number 8 in the United States for CRNA programs. So it's a fantastic program. Presently, there's 81 students in that program because they start a new group every year. So as we graduate one group, they start a new group. So Karla, can you describe the relationship between the nursing school and the Baylor Scott and White system?
I can. Thank you for asking. As you said, we've been partners since 1909. And throughout the years, Baylor nursing students have trained at many of our Baylor Scott and White health facilities, including BUMC. It's one of my favorite things to do when I'm rounding on the units to seek out what I call the nursing students in green. And I readily come to talk with them because I'm trying to recruit them to come to work for us afterwards. And I know I need to do that because the Baylor University nursing students are very much sought after by all the hospitals in the area. So we readily like to hire them while they're in school to work as nurse techs, because we want to hire them to join Baylor Scott and White Health after graduation. Since 1997, there hasn't been really a legal arrangement between the two Baylors, as we call them, which means Baylor Scott and White Health and Baylor University Louise Herrington School of Nursing. However, we do have an agreement that as long as it's Baylor continues to have the nursing school, the hospital, so BUMC, will provide a building, parking, and scholarships for our Louise Herrington School of Nursing students. I am so excited and thankful that I can go out my office and walk a block and a half and I'm at the nursing school. It makes a great relationship for the nurses to make it easy for them to have their clinicals, as we refer to them, here on BUMC campus, but also to us have a relationship with the students. Linda, what is your perspective of the relationship between the nursing school and Baylor Scott and White Health?
Okay, well, it is a very symbiotic relationship. Hospitals need nurses And nursing schools need places that they can send the students for their clinical experiences. We also appreciate the relationship because that's where our nurses get to see role models of what their life's going to be like for the next several years. So the preceptors at BUMC are great. They're good role models for our students, and we really want that to be their look into the future of what's going to be happening to them as nursing students. So for 111 years now, that close relationship has yielded what hospital system leaders sometimes call the Baylor Baylor nurse. That's one who graduated from Baylor and then started working for a Baylor hospital. Both sides benefit from this long-standing, valuable relationship, and we plan on it continuing for decades to come. And by the way, I am a Baylor nurse. And since I graduated from the nursing school here, I actually worked, like Dr. Ramberger mentioned, as a tech my very first junior year, and then as a nurse assistant my senior year. And then, of course, took my very first job as an RN at the hospital and stayed there for 33 years before returning to the nursing school. So we have come a long way in nursing. We have a short story to read to you about what nurses' duties were in the 1900s. I'm not really sure why they would ever call this the good old days, because it certainly does not sound like the good old days to me. But I thought it was just very interesting to see how the profession of nursing has definitely transitioned through the years. So we start out by a nurse's duty being to sweep and mop the floors on your ward and to dust the patient's furniture and windowsills. So even back then, they knew that cleanliness was a great part of nursing care. Number 2 is maintain an even temperature in your ward by bringing in a scuttle of coal for the day's business. Now, today, you do not have to bring anything to keep your patients' rooms either warm or cold, but back in those days, you were responsible for the environment. Light is important to observe the patient's condition. Therefore, each day, you need to fill the kerosene lamps, clean the chimneys, and trim the wicks. The nurse's notes are important in aiding your physician's work. Make sure make your pens carefully. That means they were actually not picking up a bunch of big pens in the office, but they were having to make their pens. You may whittle nibs to your individual taste. Number 5 says each nurse on a day duty will report every day at 7 a.m. and leave at 8 p.m., except on the Sabbath. On that day, she would be off from 12 to noon, 2 p.m., from 12 noon to 2 p.m. Now that hasn't really changed that much. Most of our nurses are still working 12-hour shifts, coming in at 7 and leaving as close to 7 as they can in the evening, or coming in at 7 in the evening and working till 7 in the morning. So that one's not too terribly different. Graduate nurses in good standing with the director of nursing will be given an evening off a week for courting purposes, or 2 evenings a week if you go regularly to church. Each nurse should lay aside from each payday a goodly sum of her earnings for her benefit during her reclining years, so that she will not become a burden. For example, if you earn $30 a month, you should set aside $15. So half of everything you earned was to go into retirement. Any nurse who smokes, uses liquor in any form, gets her hair done at a beauty shop, or frequents dance halls will give the director of nurses good reason to suspect her worth, intentions, and integrity. And then number 9, the nurse who performs her labors and serves her patients and doctors faithfully and without fault for a period of 5 years will be given an increase by the hospital administration of 5 cents a day. So I think a lot of things are a whole lot better than they were back in those days. And I'm really glad to see that we've made some tremendous changes in the nursing world.
Me too.
So Karla, this month marks 15 months since our world was disrupted by the pandemic. Nurses have received much deserved praise and celebration by those that now recognize how valuable nurses are to everyone. Can you tell the audience some of the great statistics you shared with us about the Baylor Scott and White system and COVID?
Oh, thank you for asking. Yes. You know, when the pandemic first started, there was so much unknown. we didn't know as much as we do today about personal protection, what we needed to use, N95s, masks, of course, gloves we use all the time, but even how much did we need to use? Even during that unknown, it was the nurses that continued to go into the patient's room. When the pandemic first started, we didn't have housekeeping, we didn't have dietary, we didn't have physicians for the most part go into the rooms. The physicians would do their assessments based on the nurse findings or stay very small amount of time. We didn't have techs that helped, but as we learned more and as our supplies of PPE increased, we did reintroduce other members of the care team. But even during that time of the unknown and when personal protection equipment was scarce or limited, we've had less than 1% of our nurses convert to COVID positive. So we have been very fortunate that we already had processes in place to protect ourselves and followed that knowledge. As we continue to watch, we continue to be focused on our nurses' spiritual and emotional and mental health post-pandemic or as the pandemic continues, because our nurses are continuing to lean in. I can tell you the vaccination has been such an uplifting both physically as well as mentally for the nurses. And over 73% of our nurses and our team members have been vaccinated at BUMC. We are continuing to increase that number by answering questions and helping our staff members that have been reluctant to get the vaccine to meet with a epidemiologist or another provider to discuss their concerns. Our vaccines have been so successful that we have given, for Baylor Scott and White Health, over 520,000 vaccines. And at BUMC, in our area alone, we've given over 122,000 vaccines. And Dr. Plank, I want to take this moment to thank you and your team for all the help that we received from the nursing students. As I would walk through the vaccines and see the students in green, as I said, with their smiles and they're helping. And I even said, why do they're doing traffic control sometimes or just monitoring the patients, but they were so willing to be there. And we asked them to be there long hours, early and late, in a very crowded situation, but they got to experience, like I did in the vaccine clinic, the joy of our community receiving the vaccine. I heard so many times over and over, I can finally hug my grandmother. I can finally hug my mother or my father. And that's what the vaccine has brought us. We are still continuing to promote and make available the vaccine. In fact, at our clinic here close to our campus, we have a vaccination clinic that is open for walk-ins. We want to make it as easy as possible for people to receive the vaccine. So if you know of anyone that is looking for the vaccine, they are welcome to use the Baylor Scott and White Health app and find a place. They can schedule it or walk in. So again, Dr. Plank, I want to thank you so much for your support and the support of the students. We could not have staffed the vaccination clinics like we did without the help of our students.
And I want to thank you for showing our students what population health is really about. Most of our students can't wait to get their first job in the hospital and deal with acute care. But this time they got to actually experience what preventative health care is all about, to really see everything that goes on when you're looking at controlling an entire population, not just in an acute care setting, taking care of the patients that you have that day. So if we had tried to plan a population health experience for them, it would not have been near as good as the real one that happened while these students were in nursing school. And they'll take that with them from now on. They'll always remember their time in the vaccination clinics. So in conclusion, we've learned much about the world during this pandemic. There's actually been some really good things that happen. And I think there's some things that we will continue to do even when the pandemic is over with. We mentioned the well-deserved praise that the nurses have received, and the parades that different hospitals had were just heartwarming to be able to see that people would bring balloons and would be honking their horns and going around and really praising the nurses for the hard work that they were doing in a fairly, difficult and maybe scary environment at that time. Another thing we've learned is that we can effectively connect via Zoom. I don't know how many times I've heard stories of the nurses actually turning their own phone on to FaceTime to allow somebody to visit with their grandkids or their spouse or someone that they haven't been able to see since they were isolated in the hospital. And I'm not sure we would have used those techniques in the past if we hadn't really thought about how much the connection would mean to people. We've had so many meetings via Zoom and Teams and webinars like this one. So I think now in the future, we'll use those techniques rather than traveling to every single thing that we have to experience. We've learned that some education might be delivered effectively online. We've learned that some employees might be able to productively work from home. Most importantly, we've learned how valuable socialization is to overall health. And if we may have known that in the past, but we really could see it on a daily basis that when people are isolated, it does affect their health. And so it's good to know that that socialization is extremely important. Nurses have always known the power of touch. And even if that touch had to be through a couple of layers of gloves, we've known how valuable that was. Patients need their nurse to hold their hands and touch their shoulders as they care for them. We tell our nursing students that they are the hands and feet of Christ. We would be glad to answer any questions that have come up at this particular time. I see a couple of people have used the question and answer button to send their questions. So let me see. The first one is, can both of you give an example of something that was challenging to you during the pandemic and that you were able to overcome successfully?
Dr. Plank, I can take that to start with, if you don't mind. Because during the start of the pandemic, but also continuing, the thing that I struggled with most is the unknown, and that I was asking my nurses to go into patient rooms and to provide care when we didn't have all the answers. I also was very aware that I was asking this of the children, the daughters, the sons of mothers and fathers, because my own son is a nurse and works in a hospital and was on a COVID unit, that I knew another CNO was asking him to do the same thing. It was very challenging mentally, physically, and emotionally, and I addressed it with prayer and asking God for grace. But I also joined the frontline nurses in prayer and shared my concerns and shared how I was in a dilemma of what I was asking them. And I also gave them permission to say, pause, not right now, I need a break. So how I would say the challenging, because it was so different, is how I addressed it was by being present and being honest and transparent. And that's what the nurses wanted. That's what the clinical team wanted, because they knew we didn't know the answers. So they wanted us to know. They wanted to know how much we cared. So I think today, when I look back, it wasn't pre-planned, but the success I had was being present and sharing them in my request for prayers.
Very good. One of the challenges that we had at the nursing school was the brief several months that we really were not allowed to be in clinical settings because everybody was just trying so hard to do the best job they could to take care of patients while we were learning on a daily basis what we needed to do for the patients. We did have to remove our nursing students from the clinical setting, and we had to learn how to give that same experience in our simulation labs or virtually. And so we did learn how to do that. I think we've gotten a lot better at it since then, but it was a challenge at first just to try to stop and think, okay, we're so used to going into the hospital and showing them how this and that happens, and we didn't have that exact experience. So we duplicated it in the labs, or we found videos, or we did some virtual education. Some of that I think we will keep. We actually have found that some of the virtual videos that we have are excellent for learning. And so we may not bring all of our graduate students back to campus quite as often if they can learn just as well via distance. So I think that was the biggest challenge to us, is how to all of a sudden change what we've been doing for 111 years and figure out a way that was just as good to give the students the clinical experience that they need. We know that if the students are not in the clinical setting applying the knowledge that we give them in the classroom, they are not going to be able to be the kind of nurse that we want them to be. So it takes both. They've got to learn in the classroom, and then they've got to apply that in the clinical setting in order to be the nurse that we want to graduate. Another question we have is, as a Baylor nurse myself, this comes from Mark Fisher. He's a 94 graduate of our school, and looks like he works in your kidney liver transplant unit, or he did for a while, from 94 to 95. Are there volunteer opportunities available to help support current and future Baylor nurses? My experiences at the Baylors were truly meaningful, and as a result, I'm interested in finding ways to give back beyond financial contributions. So, Dr. Ramberger, I'll let you answer about volunteering in the hospitals first.
We do have volunteers at the hospital, and how they directly help future Baylor and Baylor nurses would be interacting with them. But right now, we have not brought the volunteers back into the clinical settings, just because of our concern with COVID. But we will be increasing. We have brought back some of our volunteers that work with our health and medicine, through music medicine, art medicine, those type of volunteers, but we haven't brought the volunteers back. But we do have a very robust volunteer program at all of our Baylor Scott and White Health hospitals. It's just not open right now.
Okay, and there are many opportunities to volunteer at the nursing schools also. I think especially since it sounds like Mark is a male nurse, we still only have about 11% of all the professional nurses in the United States are males. So we need very strong role models for our male students. They're very well accepted, and they're usually very rapid to get jobs as soon as they graduate. But I think since they are in the minority, it's really helpful to have strong role models, tell them how they progressed in their career, and to really be able to show our male nurses that what a rewarding career the nursing can be. For all of our nursing students, though, a specialty area like the transplant unit, they would love to hear the stories about that. And of course, with transplants, it's so rewarding because you are giving people a second chance at life. And I know when I worked when 14 Roberts was the transplant floor, I would keep the letters that we got from family members and patients, really just talking about how their life got so close to being, not the kind of life that they wanted to live. And then they got the transplant, and life went on for, years and years afterwards. And it really was a second chance at life, and extremely grateful people that really knew, how valuable their receiving that organ was. So I think that, Mark, you could come talk to our students about that part of your life. They not all have been able to see a transplant unit in operation, but they would love to hear the stories about how you helped people have a second chance at life. Another question is there a certain piece of advice that you were given as a student on your journey that helped you along the way? What would you share with those that are currently on that journey? Dr. Ramberger, do you want to start with that one?
Sure. Reading that question made me think back to my nursing school time, and several pieces of advice. One of the best was, you will get through this. So I talk to students that too, because it's a very difficult journey. And it should be, because we are asking much of our students as they become nurses, but our community is asking much of us to be their care provider. But some of the best advice I got as a student was from patients. The advice they gave me just through their thank you, and the families that you make a difference for. I discovered early on that I wouldn't probably remember some of these patients or family members, but I knew they would remember me. And that was very powerful to me as I went with a provider to tell a family about a patient's death or a diagnosis, or if I celebrated with the family when a patient was going home. I realized how they talked to me, that I was making a difference. So it weighed heavy on me, but it also excited me to know that I would continue to care for these families in my heart, if not physically.
Very good.
So,
Some of the advice I received, and I believe this was when I was working as a student over in the hospital, the nurses that were on my unit would always take the nursing students under their wing and try to show them everything that there was to see and really tell them things that they could do to, to make sure that they would continue on their journey as a nursing student. And those nurses told me that I needed to think of every single patient in that bed as somebody's father, somebody's son, somebody's grandfather, not realize that it's just a person in that bed, but they're a relative to someone, and they really, really need the kind of care that, that everyone deserves when you're sick. So instead of walking into a room and just thinking, oh, this patient might have been a little bit grumpy last time I talked to him, remember that that is somebody's grandfather, and you need to treat them with the exact amount of care that you would want your own grandfather treated if they had an illness and were in a hospital. So I think that that's just the personalization that we try really hard for our students to take with them when they go in the hospital, is everyone is someone's relative and everyone deserves that genuine care that comes from being a caring nurse. And that's why we've been able as a nursing profession to win some of the awards that we've had here lately, and to be, one of the most respected professions out there for so many years now. So good advice, and something that we'll continue to tell our students. So Dr. Ramberger, did you think of anything else that this audience might want to know about the relationship between the two Baylors?
I haven't thought of anything extra, but I hope they take away about the powerful and meaningful and purposeful relationship we have. And I truly believe that we are meant to be here. We are doing God's work. As you said, the students are Christ's hands and feet, and that is not lost on our leadership. So it's a very purposeful and blessed relationship that we have.
I agree. I think that one of the reasons our nursing school is such a successful nursing school is we have the strong partnership with Bumpsy across the street, and now 52 hospitals in the Central and North Texas area that help our students get acclimated to that role that they're going to be in. Many of them get hired by the Baylor Scott and White facilities, and many of them get oriented that way. And then it's not too long till they're a preceptor for somebody, and you pass it on and you move it forward from then. So we're very fortunate to have the relationship. It's a very comfortable relationship for us since it's been here for so long. And I look forward to it lasting at least another 111 years. So thank you, everybody, for joining us today.